I'm Dr. Michael Blumenfield, and this is Shrinkpod. I'm talking with Dr. Abraham Halpern, Professor Emeritus of Psychiatry at New York Medical College and a past president of the American Academy of Psychiatry and the Law, and he's also a leading expert on ethics and forensic psychiatry. We're going to focus now on substance abuse and specifically on marijuana. Do you view marijuana as a drug of abuse that's contributed to the emotional problems of many people, particularly young people in our society?
Well, it's a drug of abuse without any question. And as far as emotional difficulties, we have to distinguish between serious psychotic disorders and general non-psychotic problems. With regard to psychotic disorders, individuals such as people suffering from schizophrenia could have their condition accentuated if they take marijuana for a reasonable period of time. Other than that, serious psychotic disorders are not caused by marijuana use. And if that were the case, we would have far more schizophrenic individuals in America than we have today.
What about the chronic, regular use of marijuana by young people today?
I would say that it has an adverse effect without any question. If it's used fairly continuously, like every day, for example, I think that a young person would have certain kinds of impairments.
So you're talking about the so-called amotivational syndrome?
That's a good word to describe it.
And what about the effect of marijuana on things like reflexes?
I would say it has an adverse effect on that. Again, one must be careful when using marijuana not to drive, because that endangers not only the individual, but innocent people.
What do you think about the idea that the use of marijuana is often a prelude to the use of other even more dangerous drugs?
That is a myth. We know that there are over 20 million Americans using marijuana every day. And to suggest that this opens the door to heroin and cocaine use, there would be a vast number of such individuals appearing in emergency rooms.
It is probably not, or it definitely is not a good idea for marijuana to be available to young people.
Better law enforcement directed to this group of people who are using illegal marijuana would be very helpful.
Why do you think it's so difficult for law enforcement to prevent marijuana from being used in this country?
It's difficult because the very large number of people that are using it, and the fact is that marijuana can be grown so easily. So not only is it easy to smuggle into the country, it's easy to produce it right here in the United States. Very difficult for law enforcement.
We know that marijuana doesn't cause people to be physically dependent on marijuana, but do you think there is a habituation or a psychological dependency on marijuana by many people who use it?
I think that can happen, yes. Most people who use marijuana don't use it every single day or several times a day, but certainly it could cause problems.
What about the positive effects of marijuana, possibly in various medical conditions?
Well, there's just no question that marijuana has therapeutic value in a variety of conditions. And I feel that it's important to legalize it for individuals who have severe illness, such as terminal cancer patients in pain, that's just an example, who are not responding to conventional treatment, but do have relief of their symptoms by the use of marijuana or certain kinds of marijuana. There are various grades.
Well, when physicians use marijuana, isn't it usually used in the form of THC and actually in the form of pills?
The synthetic production of marijuana-like substances is not as effective as the usual marijuana that's available, especially if it's inhaled rather than taken as a pill.
Who produces the marijuana when physicians prescribe it?
In this country, there are 12 states that have legalized medical marijuana. Unfortunately, the federal government has not legalized it. So it's very difficult for individuals, even in states where it's legal, to actually obtain the appropriate marijuana. Incidentally, New York State, the Assembly of the Legislature, has passed a law allowing for medical marijuana, and the Senate in New York is about to consider this legislation.
How would you like to change the law so marijuana would be more available for medical use?
I would like the government, the legislatures of each state, to pass a law under very strict conditions, limiting the use for serious medical conditions and having clear-cut licensing provisions for individuals who are going to sell the marijuana. Now, an example of how it shouldn't be done is what's happened in California, where apparently individuals suffering from conditions that we would not consider appropriate are obtaining marijuana, and the problem of diversion of marijuana to people who should not really be having it is significant in California. So that would be an example of laws that shouldn't be passed, whereas an example of a law in Canada covering the whole country is perfectly okay, very carefully controlled.
Why are so many people against the proposed change in the law that you advocate for?
One of them is that a wrong message would be passed to young people that it's okay to use marijuana. Another problem that people are very concerned about is the problem of diversion. Marijuana then somehow slipping away from the very sick people to individuals who are using it for recreational purposes.
Do you think it's worth the risk of giving this message to young people and worth the risk of diversion? Couldn't we just stay with THC, rather the pill form that doctors do have available to prescribe, rather than allow the production of marijuana that would be inhaled and would stand the chance of diversion as well as giving the wrong message to young people?
No, because we know that that problem can be controlled and is being controlled in the case of morphine and cocaine and other substances which can be used therapeutically.
How much better is inhaled marijuana than taking it in the THC form, the pill form?
According to the reports that I've had from patients who have tried them both, there's just no comparison.
Could that not be placebo effect? Don't you think we need controlled studies?
We absolutely need controlled studies, and more than that, we need acceptable research efforts done.
You think there are things holding up the National Institute of Mental Health from doing this kind of research?
The National Institute of Mental Health requires allocation of funds provided by Congress. And if they were to engage in this type of research, they would find that their funding for other important areas would be curtailed by political influences.
Thank you very much, Dr. Abraham Halpern, for being my guest today on Shrinkpod. Shrinkpod is also available on YouTube. And until next time, I'm Dr. Michael Blumenfield, wishing you a very pleasant day. You have been listening to Shrinkpod, which has been coming to you from the campus of New York Medical College at the Behavioral Health Center of Westchester Medical Center in Valhalla, New York. This program is supported by a grant from the Sidney E. Frank Foundation. I'm Dr. Michael Blumenfield, wishing you a pleasant good day.